Peter Dutton's backing of Anthony Albanese's backflip to include a LGBTIQA+ gender and sexuality question in the census is further proof of the major party's capitulation to radical green left ideology. Dutton, who once criticised the woke agenda, has now stated, "I'm fine with the question being there," end quote. Albanese's earlier backflip came after a cabinet revolt when the Greens and LGBTIQA+ activists like Louise Pratt in the Labor Party jacked up. His backflip is now supported by the Liberals and Nationals, and it means there will be questions in the census that seek to divide Australians by sexual practices and gender identity. Now, this isn't just a change of heart from Albanese and Dutton. It's a clear sign of the ongoing surrender to a dangerous ideology that puts girls, women and children at risk. It's disappointing to see this decision in the wake of last week's, or the recent, I should say, Tickle versus Giggle case, where a biological man, Roxanne Tickle, won his case against Sal Grover's women's-only app Giggle for excluding him because he is not a woman. But if so-called trans women are really women, as Justice Bromwich of the Federal Court asserted in his judgment, then Dutton and Albanese should not need separate gender identity questions in the census. It is nonsensical for the LGBTIQA+ political movement, what a word salad that is, to demand such a question if they really believe people like Roxanne Tickle are women. Surely checking the woman box on the census form would be sufficient without its own sort of gender identity category. It just proves that what they're saying is not true. And that's because the political agenda at play here is to make radical sexual and gender minorities more visible as part of the indoctrination project of the wider population, particularly the indoctrination of children. Now, with both leaders of our major political parties backing radical green left ideology on gender fluidity and radical sexuality in the census, fixing the law to protect women and girls becomes even harder once it's baked into the way we collect our data. That, of course, is the game plan of the activists to which Dutton and Albanese have capitulated. And on the question of sexuality, what people do in their bedroom should remain there and not be thrust upon the rest of us via the census form. The idea that gender and sexuality should be in the census is this week's fake news. Well, has the Victorian Health Minister Mary-Ann Thomas misled the Victorian Parliament about controversial gender treatments recommended for adolescent girls by the Royal Children's Hospital in Melbourne? It appears so, and this relates to whether or not the Child Gender Clinic at RCH is referring girls who are distressed about their gender to private clinics where they can receive irreversible double mastectomies. That is, to have their healthy breasts removed so they can appear as boys. Now, earlier in the year, I brought you news that the courageous expelled Victorian Liberal Upper House MP Moira Deeming had put questions on notice to Thomas about the activities of the public gender clinic of the Royal Children's Hospital. Thomas had earlier told Parliament in 2023, in response to questions from Deeming, that, and I quote, "The Royal Children's Hospital does not provide or refer children to surgical treatment," end quote. However, in response to follow-up questions from Deeming, the Minister has changed her tune and now says the RCH does refer children for what she euphemistically describes as gender-affirming surgery. To be clear, that is the removal of healthy breasts so a girl can appear as a boy. Here is what Thomas told Parliament in a written response to Deeming just last week. Quote, "In line with the Australian Standards of Care and Treatment Guidelines for transgender and gender-diverse children and adolescents and World Professional Association for Transgender Health Treatment Guidelines, Standards of Care where clinical need is determined, RCH clinicians may refer adolescents to a private specialist clinician to consider the appropriateness and need for surgery," end quote. Now, this revelation that RCH is referring children to private clinics for surgery was broken by journalist Bernard Lane on his Gender Clinic News Substack blog. Bernard joins me now. Bernard, you've been providing critical analysis of Australia's child gender clinics for some years. How significant is this revelation by the Victorian Health Minister?
Thanks, Lyle. I think it is quite significant. At one level, people following this area closely had been hearing anecdotal accounts of under 18 gender clinic patients being referred to the private sector for possible mastectomies. But this answer given to Mrs. Deeming from the Health Minister in Victoria is the first time that it has been officially acknowledged that a children's hospital gender clinic is referring minors to the private health sector for possible mastectomies. And it's interesting that it took Deeming so long to extract a clear admission. And I think that tells you that the government itself is quite aware that this practice is unlikely to be looked upon favourably by mainstream Australians.
Bernard, has Marianne Thomas misled the Parliament?
Look, I think a reasonable person could well conclude that. Technically, she could say that when she was referring to children not being referred to private clinics, she meant children as opposed to adolescents. But, you know, we're talking about a gender clinic that is in a children's hospital and under Victorian law, for example, someone under 18 is legally a child. So I think her belated distinction between children and adolescents shows that her previous assurances were unreliable.
Bernard, what do you think mainstream Australians would make of a children's hospital referring children to private clinics to have healthy breasts removed?
I think most people in the mainstream would recoil with horror and disbelief. And I found this myself when I've explained to people at social functions that, yes, children under 18 are being referred for double mastectomies. We know that from family court decisions. And on a number of occasions, the person I'm talking to insists that I must have got it wrong, that legally that could not be possible. So I think that there is a serious reputational issue here for the Royal Children's Hospital, because I would think that in the mind of most Australians, they would not associate a children's hospital, which is looking after sick kids, with an institution that is referring distressed girls for double mastectomies with no good evidence that it's going to help them mentally and with obvious irreversible harm to their bodies.
Yeah, Bernard, this is a very controversial area of medicine, and I noticed in her reply, Marianne Thomas references the World Professional Association for Transgender Health Treatment. Now, recent leaks have left this organisation discredited. Can you remind our viewers why this is the case and why it's not credible for Australian child gender clinics to follow their advice?
Well, the World Professional Association for Transgender Health, known as WPATH, is an American-based body. And I think there's a general view among those who have looked at this body closely that it is not a normal mainstream medical society, that it is primarily an activist lobbying organisation. And some of the revelations that we've had in the US recently suggest that the people involved in WPATH have been engaging in scientific misconduct. For example, trying to suppress awkward results of reviews of the evidence, suggesting that the treatment that WPATH is recommending is not evidence-based. There's also evidence that a senior official in the Biden administration successfully lobbied WPATH to remove all age minimums for trans surgeries in the most recent WPATH treatment guideline. There's only one particular surgery where they have retained a minimum age, which is the creation of a pseudo penis, because I think even WPATH recognises that is a very complex operation with poor results and lots of very serious side effects and complications.
So Bernard, does it surprise you then that an Australian health minister is citing WPATH in a response to questions on notice in a parliament?
Well, she is in a difficult position because if these treatments, puberty blockers, cross-sex hormones, surgery for minors, if those treatments rested on good quality evidence, then the health minister would be able to say that. But she cannot, because multiple independent systematic reviews of the evidence in a number of countries have shown that the evidence base for these so-called gender-affirming treatments is of very low quality and very low certainty. In other words, we don't really know what effect it's going to have, and the risks and the harms are obvious. So the minister is in a difficult position. She can't claim that these are evidence-based medical interventions, and so she falls back on quoting an organisation which sounds like a mainstream medical society but is not.
I just press you on that though, Bernard. I mean, WPATH, the leaks surrounding them, the information you've just reminded us of, that's been well publicised. The Economist has picked up on this, and yet you've still got a minister referring to it as if it's some credible authority. Clearly it's not. Bernard, the number of Australian children presenting at gender clinics has been described as an epidemic. Can you give us a sense of the numbers and how many children might be being prescribed puberty blockers and cross-sex hormones and even referred, for surgery?
Yes. Well, the dramatic increase in new patient numbers in the Children's Hospital gender clinics has been observed since about 2015. We're talking about exponential increases. The caseloads of some of these larger gender clinics are several hundred new patients a year. So per capita, I mean, I haven't done this calculation, but I suspect that per capita there is, more gender medicine going on in Australia than was the case under the Tavistock Clinic in England, that being the gender clinic which was shut down as a result of the Cass review.
You mentioned the Cass review, and it's led to the banning of puberty blockers being prescribed to children with gender distress in the UK, and that's something which the Keir Starmer Labor government has upheld since it came to office. The Tavistock Gender Clinic, as you say, has been closed. Why are Australian politicians not looking at the evidence overseas, and why are they not taking action?
I think a big part of it is that our media coverage has not been as accurate and effective as the media coverage in the UK. In the UK, there were several mainstream media outlets covering quite closely the shortcomings and concerns at the Tavistock Clinic. That included the public broadcaster, the flagship investigations program Newsnight of the BBC did a lot of serious investigative work. In Australia, the counterpart program, Four Corners on the ABC, has functioned instead as an uncritical platform to promote these gender-affirming treatments. So the poor media coverage is part of it, and I suspect also that the litigation run by the detransitioner Kira Bell in the UK, she was a former patient of the Tavistock, even though that case was ultimately not successful at the level of the Court of Appeal, the revelations made in court about the shortcomings and concerns at the Tavistock, I think, had a profound effect in the UK. The other factor, of course, is that the UK has had the benefit of the Cass review, the world's most comprehensive review of the care of these young gender-distressed people, run by the eminent paediatrician Hilary Cass, over a period of 4 years, with an interim report and the final report in April. So the situation in the UK is dramatically different from the situation in Australia. But it's also the case that because of poor media coverage, the gender clinicians in Australia and the Australian health ministers, with one exception, have been able to successfully argue that the gender clinics here in Australia are somehow different from what was going on at the Tavistock, and that there's no need to worry about our clinics. But in truth, there are very strong parallels between the gender clinics here and the Tavistock, and for that matter, gender clinics in multiple other countries around the world, which are using exactly the same treatments, puberty blockers, cross-sex hormones, surgery, and they are seeing pretty much the same group of atypical patients being adolescent girls, when it used to be the case that there was a very, very small number of patients with this gender distress, and they were overwhelmingly males, and the gender distress began in early childhood. But now, you know, in our clinics in Australia, as in the Tavistock, as in the US, etc., it's predominantly adolescent girls who have this, you know, apparently sudden onset of gender distress. So the CAS review is relevant to Australia, despite some, you know, relatively trivial organisational differences between, you know, Australia and the UK. I mean, the UK has a more nationalised health system, you know, and here in Australia we have a fragmentation across the Federation, and our gender clinics are based in children's hospitals.
Yep. Bernard, it just defies credibility that our gender clinics can claim they're different to what is going on in the UK and other Northern European countries that have now stopped this practice. I wonder whether the lack of proper media scrutiny here in Australia, and therefore political action, we've seen you know, a couple of attempts to have parliamentary inquiries into the gender clinics voted down in the federal and in the South Australian Parliament. Is it because of the political lobby, the likes of Equality Australia, which continue to lobby for this type of so-called gender medicine to be continued in Australia? Is that part of it? Is it a fear of this strong rainbow political lobby that's causing the media and the politicians to balk at taking action?
I think it is, Lyle. I think the broader issue is that if you think of there being a political and media culture, then the political media culture is somewhat to the left of the general mainstream. It has a progressive worldview, and this particular kind of medicalisation has been framed as progressive medicalisation, and the surge in trans identification among kids has been likened to the gay liberation movements of the 80s and 90s. Now, I mean, those parallels don't really hold if you look at it carefully, but what the effect of that is that politicians know that if they start to ask difficult questions about these medical interventions with kids, you know, about the risks, the benefits, the harms, that they will be pilloried as anti-LGBTQIA+, etc. And the national broadcaster, the ABC, which has considerable reach, will be at the forefront of a mob, you know, crying for their scalps. And it's very difficult to get through the message that some proportion of these gender-distressed kids, if they were left alone and not medicalised, would probably grow out of that distress. They would re-embrace their biological sex, their birth sex, and some proportion of them, an unknown proportion, but some proportion of them would emerge as young gay or bisexual adults. And this is why there is a big divide now between the T and the Q in that acronym and the LGB. So there are LGB people saying that we have nothing in common with the T's and the Q's. And the T's and the Q's are sterilising and rendering lifelong medical patients of children who might otherwise grow up as gay or bisexual. But if you look at the Australian media, that word salad acronym is always used as if there is such a thing as an LGBTIAQ person. No, there is no such person. I've never met anyone who has told me that I am LGBTQIA. You know, people are gay, they're bisexual. Some people call themselves queer. Some people call themselves trans. And trans and queer are very different from LGB, because LGB is about sexual orientation and it's about biological sex, whereas the T's and the Q's are about the denial of biological sex and the erasure of same-sex attraction.
Yeah, well, that's right. Well, look, you know, I think journalists need to be asking some questions of the main political activist group, Quality Australia, led by Anna Brown, who is driving all sorts of political agendas through our parliaments. Bernard, we really appreciate the work that you're doing. People can go to your Substack, Gender Clinic News, to follow this debate. We really appreciate your time today on ADH TV.
Thanks, Lyle.